Well, the Split the Pot lottery, it's on right now, giving you a chance to win some money and also help raise funds and awareness for Ontario's hospital and healthcare system. One of those hospitals that benefits is the North York General Hospital. Gian Lee is live there this morning with a look at how the fund benefits them. G, good morning. Get ready to split some cash.
Yeah, really, for sure. Good morning, Nick. And we are here in the emergency room at North York General Hospital. And as you mentioned, this is all about Split the Pot. The largest jackpot guaranteed right now, sitting at $750,000. I'll tell you how you can win tickets or purchase tickets and win this in just a moment. But I'm joined by Andrea Ennis. She is the director of the emergency department here. Good morning.
Hi. Welcome to North York General Hospital.
Oh, listen, I have been here before. I gave birth here almost 16 years ago to my son. Yeah. Amazing. It is quiet here.
Yeah, except at the Charlotte Lewis Steinberg Emergency Department, we're one of the busiest of the 75 hospitals on Ontario. But we are one of the most efficient, and our performance is in the top 5 of Ontario. We have spent so much time working on how to deliver world-class care in a timely and efficient manner, and we've got processes and procedures that have really been able to keep a quiet emergency department that's really efficient in taking care of our community. And we're really lucky because now we're going and helping other emergency departments try to replicate what we're doing so they can help their community.
Oh, so don't be fooled that it's quiet. It is still busy, but the efficiencies help get everything going here.
Absolutely, one of the busiest in Ontario. But if you're doing it right through a lean methodology and you're looking at your processes, you can be efficient and you can create a quiet emergency department.
Yeah, and then I can't help but notice it somewhat feels like it's been newly renovated.
So in the Charlotte Lewis Steinberg Emergency Department, this area that we're in, we call it the green zone. Lumps, bumps, bruises, casting, broken bones, cuts. This has all been donated by our community donors. We are so grateful for the community that wants to give back to the hospital in any way they can.
Okay, thank you so much.
Yeah, no problem. Welcome.
And then, of course, probably the busiest man here at the hospital, Dr. Watzko. How are you?
Hi, good.
Okay, so we're in this room. Tell me a little bit more of this. This is a donor-funded room that we're looking at.
Yeah, so we're in a room that has recently been refreshed through donor funds within the last couple of years. You know, the funding that we receive from the government to run the hospital, to run our emergency department, allows us to meet the needs of our patients. But it's through charities like Split the Pot, the generosity of our donors, our wonderful foundation, that we're able to really take it to the next level and provide exceptional care to our patients. And it's because of the equipment they provide, our ability to refresh and have the spaces that are appropriate to meet the needs of our patients, that we're able to do that.
Yeah, and that's so important because I've always said we have the most incredible, talented healthcare workers in this country, but it helps when you have the latest, greatest technology to help you in assisting patients. And we're seeing an example of that here in this room.
Yeah, definitely. We've had our foundation donate funds so that we can have the most up-to-date bedside ultrasounds to make quick diagnoses at the side of the bed, to be able to work in spaces like this. Our new Purple Zone, which is a refresh of an area to provide the latest and most appropriate care for our mental health patients that we're very proud of. So it is really because of the generosity of our community and the funds that have been raised through our foundation that we're able to provide the care that we're proud to provide.
Yeah. Well, I always say this to every healthcare worker that I meet. Thank you for everything. You know, we wouldn't be here and we wouldn't have this kind of incredible hospital system if it weren't for doctors like you and the nurses and all the staff members. So thank you.
Thank you.
And as Dr. Watzko mentioned, you know, donations are huge, but here's your chance to win some money as well. It's called Split the Pot, and basically it is the biggest guaranteed jackpot. You have until June 25th to win this prize. So it's $750,000. You can choose to have your donation go to one of 79 hospitals, or you can specifically choose a hospital. For example, if you're connected to North York General Hospital, you can ask for the donation to go there. So again, the first deadline is tonight. We're talking an early bird deadline. And again, if you want more information, you can go to splitthepot.ca to buy your tickets, but also to have a chance to win this incredible prize. Scan that QR code again, splitthepot.ca. Joining me now is Shauna Miller with the North York General Foundation. I know it's kind of fun coming back here.
I'm sure it is. A lot of memories flooding back.
Yes, I mean, I'm 30 pounds lighter today, but yes, the memories do come back. And we were just talking about the importance of the community giving back donors. That's what makes a difference for all the hospitals here.
It certainly is.
Yeah.
I think there's a misnomer that the government covers everything in a hospital, but really it covers core infrastructure and operations. It's really the community support that fuels the excellence in the hospital. Research and learning, modernized care spaces, technology, equipment. That's really what our donor support gives us the ability to do every year, and so we're just grateful for that.
And North York General Foundation obviously has great support, because we just took a little mini tour of the emergency room that had a refresh, and that's really important.
It is.
Yeah.
We see almost 120,000 people through our Emerge, and so community support has allowed us to expand that space, which has really been valuable for our growing and diverse community.
Can you give us an example of some of the things that have been purchased through the donations?
Yeah, so a lot of our vital equipment, MRIs, gamma cameras, our renovated spaces. As you just said with the birthing center, we're doing a massive $22 million campaign to completely renovate our birthing center. So it is those types of things that community support does for the hospital.
And I've always said, and I said this to Dr. Watzko as well, we have the most incredible staff, healthcare workers, doctors, nurses, everyone. But it makes their job easier when they have the latest and greatest in technology to assist them.
Best for our patients to have the latest and greatest, and of course, in terms of attracting and retaining staff, they want to be working in a place that is, got modernized technology and has spaces that inspire them to do the best work that they can.
Yes, and I know that with Split the Pot, what's great about this is if you purchase a ticket, you can have the ticket donation go to one of 79 hospitals, or if there's one that's close to your heart, like North York General, you can designate your ticket for the hospital. And this is a great way for the hospitals in the GTA to gather together.
It is. It's a wonderful alternative way for our communities to support hospitals. I certainly hope people will select North York General when they buy their Split the Pot ticket. But certainly, it is a great way to get engaged by purchasing a lottery ticket.
Yeah, it is fantastic. And you were telling me that the birthing area is going to have that massive renovation.
Yes.
I don't know, 16 years ago, it felt very luxurious to me. I was happy to be there.
Well, I think, we give birth to almost 5,000 babies a year at the hospital. So the wear and tear over 16 years, you can imagine. And we really want to give our families and our staff the best environment to work in, but also patient flow and activities and things that break down and can't be replaced. Our isolettes can't be replaced anymore. The company doesn't make them anymore. Right. So simple things like that need to be updated, that community support gives us.
Oh, and we are so grateful for the community support. So here's your chance to not only give back to one of 79 hospitals or a specific hospital like North York General, but you also have a chance to win an incredible prize. The largest jackpot guaranteed, $750,000. And also, there is an early bird deadline tonight with winners being announced on Thursday. So there are two special bonus prizes as well. That's $10,000. Groceries for a year and a chance to win one of other 13 grand prizes as well. So all you have to do is scan that QR code or go to splitthepot.ca. And while you're there are bonus tickets. We're talking $600 for 100 plus 200 bonus tickets, $150 for $50, $25 for $20 plus 50 bonus tickets. There's a lot. Or you can buy 5 for $10. Listen, all the information is there, splitthepot.ca, and good luck. Shauna, thank you so much.
Thank you so much.
It's really cool to get a tour of North York General Hospital, going into the various rooms. Now we're in the OR, and I'm joined by Dr. Peter Stotland. He is the Chief of Surgery.
Hi.
That's a big title.
Thank you.
So tell me a little bit more of this machine that we see here, because there's a reason why we're highlighting this.
Yes, this is what we call an endoscopic ultrasound machine. And this is a really cool modern technology, super specific ultrasound that we use to diagnose cancers early. This is a test that not every hospital has, and we're lucky to have this technology from our foundation.
Absolutely, because this is a lot of money, we know. We're not going to actually perform the test, but we'll give you an idea of how this would be done.
For sure. This is Dr. Jamie Superior.
Hi.
Jamie is one of our endoscopists or therapeutic gastroenterologists. And he does, I don't know, about 20 to 25 of these a day.
Okay.
And in a year, he'll use this machine about 150 to 200 times to make the diagnosis of cancers early in cancer patients. So it's really helpful for our patients.
So when a patient comes in, you obviously prep them, and then what does this do? This goes through the mouth.
Well, we're gonna, if you're okay, G,
yeah.
we're gonna have a go. Jamie's gonna show you. Normally you'd be a little bit sedated, but
right.
you told me
Well,
you can.
I'm half asleep right now, so this all works.
Perfect. So
The camera goes into the mouth.
Yeah.
Usually it goes all the way down your esophagus. We're just going to put it over your tongue. And basically, you'll have a light source. And in addition to the light in the camera, the ultrasound probe is going to look through the muscles of the tongue.
Right.
It can look all through the back of the mouth. But really, we use it in the esophagus, the stomach, the intestine to look at the gallbladder, the pancreas, the liver, lymph nodes to help to, as Dr. Stalin said, to identify and diagnose cancers of the gastrointestinal system.
Wow. Okay, so Dr. Stalin, this seems like it's obviously a very important machinery and new technology.
yeah, it's advanced technology that picks up cancers earlier. And the whole goal here was to get this equipment, this technology in with the support of our foundation, with the support of people and patients in the community.
Yeah.
And the whole idea here is to pick up cancers earlier so that they don't need surgery, that they can be treated sometimes without surgery in a very early stage and ultimately do better things for patients.
And I know that a lot of people think that hospitals are completely funded by the government, but that's not the case, and that's why these donations are so crucial. And if you could buy more machines like that, it's not about finding staff, it's about getting the equipment available, right?
Unfortunately, you nailed it, G.
Yeah.
We need help. We need help from patients. We need help from people that want to make a donation to their community. Foundation money or money to hospitals and their foundation allow us to get cutting edge technology like this, robotic technology, minimally invasive, new technology that really patients in our community deserve.
Yeah, and especially for a topic like cancer, we know we're facing a tsunami of diagnosis with cancer patients, and we are seeing younger people coming in, unfortunately being diagnosed with cancer. So something like this with early detection literally can save lives.
Absolutely. Absolutely. You want to work for the hospital?
Sure, I'm having fun. Just, I know it's a little bit too much for our viewers. Let's show how this works again. This is a lot for our viewers to see.
One more time. So scope goes in over the tongue, usually down the throat, into the stomach. But again, the ultrasound probe is going to look through the walls of the organ to look at all the deeper layers. So it's pretty unbelievable.
Wow, that's a lot for our viewers to see first thing in the morning. Thank you so much. And again, here's your opportunity to not only give back to the hospital, but there are 79 hospitals involved with Split the Pot. So if you want to buy a ticket, the jackpot, the grand prize is $750,000. Plus, there is an early bird deadline. If you buy your tickets tonight, winners will be announced on Thursday. And then if you buy before midnight tonight, you will be entered for all the draws, which for June. And of course, all of this ends on June 25th. And there's so many incredible prizes. We're talking bonus prizes of $10,000, groceries for life, chance to be one of our 13 grand prize winners. So you need to scan the QR code on the screen there or go to splitthepot.ca. And there are bonus tickets as well. So stand by. It's $600 for 100 plus 200 bonus tickets, 150 bonus tickets for $50, 25 for $20 plus 50 bonus tickets there, or 5 for $10. And what's really cool about Split the Pot is that your ticket donation can go to all the 79 hospitals involved, or you can pick one hospital that means a lot to you. For example, my son was born here at North York General Hospital, so if you have a close connection to your hospital, you can select your ticket donation to go to that hospital. Thank you so much. That was a lot of fun. Thank you. I hope you've recovered from that last segment, seeing all of this. It was a lot there for morning television, right? Thank God I didn't have breakfast. It's the only way we could have done that.
Yeah, exactly. Well, good job. Good for you for opening wide.
It was really important. Yeah, thanks so much. You know me, I'm always a talker. This is always moving. But it was really important to highlight that piece of technology because, you know, today, more than ever, the technology is assisting these incredible healthcare workers and doctors and nurses to do the job. We're talking about diagnosing people early. Early detection is key. We're talking about making sure that when they come to the hospital, the latest technology is there for them, and also to see the efficiencies in that emergency room. Now we're going to talk about long-term care. And I know you can see behind me, it is an empty lot, but there's a good reason for that. Jennifer Dockery, she's the VP of Quality, Post-Acute Care and Community Integration. That's a long title, Jennifer.
It's a very long title. Good morning, G.
Good morning. But a really important title, and also this is a really important project that we have behind us. Tell me what's here.
Yeah, so I think many of your viewers will know that seniors are actually the largest growing population right now. And in Ontario, we're expecting those over 65, those numbers are going to double by 2040. So in preparation for meeting the increased needs for our community here in North York, we're building probably one of the largest long-term care homes in the province, which will have 528 beds. The unique piece about that, all of the rooms will be private rooms with private ensuite baths. And that's to allow us to be able to do best practice, to maintain the dignity for our residents. We'll be calling this place home.
The wait list is long already.
Yes, the wait list is long. We actually have more people on the current wait list than we have beds, even our future beds. So currently we have 534 people on our wait list for the 528 beds that will be coming, yeah.
But it just goes to show you the demand, and it isn't just here. We're talking there are long wait lists right through the city, right?
Yeah, no, absolutely, and there's long wait lists right across the province. In the city of Toronto, there's over 15,000 people who are waiting for long-term care beds currently.
Oh my gosh. You know, when you hear the numbers like that, it is really shocking. But then that means more than ever, we need to fund these important projects. And that's why we're here to talk about Split the Pot. But also, I wanted to talk to you then about the need for something like that and the partnership with North York General Hospital.
Yeah, no, absolutely. And so, as I said, the numbers are already telling us that there is a need, and our current state is actually telling us that there is a need for these beds, right? We're looking to build on the 40 years of providing excellence care to seniors that North York General has been doing.
And I know the hospital and the foundation has been very lucky because you do have generous donors. You really have built a community here, but you still need help.
Absolutely. And we get government support to build these beds. But what we're trying to do around transformation and creating unique space for our seniors as well, not just the folks who will be living in the home, but also our seniors who are out in the community, who we want to actually engage in a community hub. We actually need the support of our donors. Donor dollars are critically important for us to be able to achieve our vision.
Yeah, and then what I love about this partnership, like with the long-term care facility, but the hospitals, the goal first is to allow people to live healthy for as long as possible in their homes before they enter a project, something like this.
Yeah, no, absolutely.
Yeah.
So the hospital is doing a lot of work to ensure that we are supporting seniors to stay in the space where they want to live. And building the long-term care home in North York, where currently we have the largest proportion of older adults in the city of Toronto. It means that our seniors can actually stay in the environment that they've grown up in, where they've raised their families. So yeah, it's extremely important.
It is important, and I'm so glad that we are doing this. I was joking earlier because that statistic that you gave out that the number of people 65 and over will double in 2040, and I was doing the math. I'm in that category. This might be my future home.
Yes,
one day.
a lot of us are. You might want to get on the list now.
Oh my goodness. Listen, the IKEA is right there. I love their breakfast. You've got walking trails. It's a beautiful spot.
Absolutely it is.
Okay, so this is how you can get involved. You can win some incredible prizes. The jackpot is, the grand prize is $750,000. This is a lottery called Split the Pot. When you buy a ticket, your ticket donation could go to 79 hospitals, or you can pick a hospital that means a lot to you. For example, North York General Hospital. All you have to do is go to splitthepot.ca or scan that QR code for your chance to win. There are also, the very first early bird deadline is tonight. And if you buy a ticket by midnight tonight, you will be entered for all the draws for June. And they're including 2 special bonus prizes, which is $10,000. There's also other incredible prizes like groceries for life as well. Groceries for a year, and a chance to be one of our 13 grand prize winners. There's also bonus tickets if you want to purchase that. We're talking 600 for 100 plus 200 bonus tickets, 150 bonus tickets for $50, 25 for $20 plus 50 bonus tickets, or 5 bonus tickets for $10. Either way, it's a win-win for you. It's a win-win for the hospitals involved. Splitthepot.ca or scan that QR code.